Hi, I'm Eric Johnson here at Owen Graduate School of Management, and I'm here today with Bill Carpenter. Bill is the former CEO and chairman of LifePoint Health. Recently spun out into a private organization, and Bill still serves on the board of that organization, but it was one that was an important part of Nashville's history, still is a big piece of the healthcare enterprise, both here in Nashville and in the country. Welcome today, Bill.
Thanks, Eric. Glad to be here.
Well, tell us a little bit about that history. It's a really interesting piece of history for LifePoint. Share a little bit about how LifePoint came to be.
LifePoint really is one of the Nashville success stories. There's been so much entrepreneurship here. When you think about companies that have been developed, when I look every year at the Nashville Healthcare Council's family tree and I see all of the companies that have been created here, it really is amazing. A lot of them have HCA in their origins, and that's true for LifePoint. So 20 years ago, HCA made a strategic decision to focus on its urban markets where they had scale. And they made the decision to spin off a set of rural hospitals. LifePoint was formed with 20 rural hospitals in 9 states. We have stayed focused on that over the years. We've grown the company. Today, about 90 hospitals in 30 states across the country. So a dramatic growth, and it's been a great run.
And it recently was privatized.
We did make a decision recently to take the company private. You know, every year the board looked at strategic alternatives. I think that's the right thing for any board to do. And so every year in a strategic planning retreat, we would look at everything from soup to nuts. And typically, we stayed true to the mission and head down and kept doing what we needed to do. But over the last couple of years, we felt like the market really wasn't valuing the company as we thought it should be. And so we did make a decision to take the company private, which we did just in November of this past year.
And that decision from the very beginning to be non-urban, that was part of the original plan of coming out of HCA. Yeah. But something you must have revisited from time to time over the last couple decades. Why the continued focus on that?
Yeah. No doubt about it. We looked at whether or not we should remain non-urban every year as a part of our strategic planning exercise. What we decided ultimately is that there is a lot of runway left in rural hospitals. Now, there has been a shift in focus a little bit. I'd call the company more non-urban today, more community-based hospitals today than it was in those early days of very small rural hospitals. But our focus has remained on hospitals that have scale in their market. You may remember I said HCA decided to stay focused on urban markets where they had scale. We had scale by definition because we were the only hospital in town typically. And so that hospital is very important in the community. If we can create quality care in small towns, then people will stay home for that care, and we can grow volume and grow the company and ultimately acquire more hospitals. That's what we were able to do.
So the healthcare industry is constantly changing, growing. Obviously with your change this year, one of many changes that are going on in the industry. What excites you as you look forward about the industry, places that you see growth or opportunity in healthcare?
I think this is one of the most exciting times to be in healthcare. I think it is a time of evolution and dramatic change in our industry. Look, healthcare is 16, 17, 18% of the GDP. We've got to find ways to reduce the cost of care and improve quality and outcomes for patients. And so hospitals are going to continue to be important. There's no doubt about that. But I think that you're going to see sicker people in hospitals. So if you need an advanced surgery that requires an inpatient stay, you're going to have that in a hospital. If you're an ICU patient, you need to be in the hospital. But more and more, we're going to see patients moving into alternative sites of care, maybe at home. And so technology is going to become much more important than it's ever been in the past. Telehealth will become more important. So patients will have the ability to interact with their doctors from a remote location, better care close to home. And I think that's going to be important. I also think it's an exciting time, and Vanderbilt is doing remarkable work in this field of analyzing the human genome in a way that will allow us to personalize care for patients, ultimately in order to keep them out of the hospital. That'll be when we know that we've really achieved success.
So follow the patient and that quality care.
The patient is the most important thing. And the way we'll reduce the cost of care is to keep patients healthy, ultimately. And through the use of artificial intelligence and technology, we'll have the ability to understand that in a much better way and personalize that care for each patient.
Yeah. So Bill, you've had an amazing career as a lawyer and then as a corporate CEO. And along the way, I'm sure you've seen lots of things go well with leadership and then things not go well at times. Could you share a lesson, a leadership lesson?
Well, when I think about the job of the CEO, I think there are really three things. He or she has to be focused on setting the tone at the top, and that's really about culture. He or she has to make sure that a strategic direction is in place for the organization and that there are measures in place in order to be able to determine whether or not you're on track, to hold the company accountable to that strategic plan. And then you've got to have the right people in place in order to be able to carry that out. People who understand and appreciate the culture and who buy into the strategic direction that's been set. And so ultimately for me, it's all about the people and having that in place. That also means a real commitment to succession planning and making sure that people within the organization who aspire to another level have the ability to get there. I think we as leaders owe that to our folks. I used to tell people in our organization, I want you to want my job. And what I meant by that was, I want to exhibit to you that I'm having fun and that this is a fulfilling way to spend your career. I would tell all of our managers at any level, you should show people how much fun you're having so that they want your job. Not to create a competitive environment or anything else, but to help people get to the job that they really want.
Help them develop.
We should do that. It's all about the people.
That's great. Well, Bill, thank you so much for spending the day with us at Vanderbilt.
It's a treat to be here. Thank you.